sharing our stories that we reclaim our power and we hold those politicians accountable for their decisions. And in this big, beautiful bill, we said we wouldn't cuss, so I won't call it the big BS bill. But it has serious implications for Medicaid. It's going to cut upwards of $790 million from Medicaid, and automatically out of the 10.8 million who receive Medicaid, about half will be bumped off for new work requirements, which we already know are very popular here in the state. 63% of parents who use Medicaid are already employed, so this is not going to make a market difference. And so this is an issue that will have immediate consequences right here. Another thing that we're seeing that cuts, the DOGE cuts to our government agencies who do grant writing and the National Institute for Health and other types of programs that make sure that scientific research is funded. Those have been cut, and that leads to just devastating impacts. We're here in the state of Missouri where our vaccination program is suffering cuts that mean closure of an agency that used to track and make sure that we have enough measles vaccinations in this state. A public health crisis combined with cuts to essential services will mean a death sentence. I talk to seniors across the district who play this game of Russian roulette. I've got to pay my rent, I've got to pay for groceries, I've got my prescriptions and my doctor bills, and my utilities. Which one gets paid which one do I leave out of that rotation this month? Having insurmountable medical debt isn't just an issue of financial security, it's a generational, how you were able to have legacy in your family and pass on wealth from generation to generation. And it also really restricts, we heard about how, when Medicaid was, when the Affordable Care Act was passed, Missouri voted to expand Medicaid expansion. When our politicians here, Bob Onder was around during those days, I hear. They asked for Medicaid expansion. Our politicians overrode our vote, just like they did with Amendment 3, just like they did with Prop A. They made sure that people who needed health care couldn't get it, and as a result, rural hospitals all across the state closed or significantly shuttered services. Now, if you're here, I don't need to tell you guys, if something really bad happens to you, how long does it take for you to drive to a hospital? Depending on the level of trauma, you're probably going to Kansas City or St. Louis if it's severe. So we're already seeing the impact of what happens when politicians override our votes, especially when it comes to healthcare, and we cannot allow them to pass these Medicaid cuts. I will say, Josh Hawley, to his credit, he is starting to buckle, or maybe the winds of opportunity are blowing in a different direction. But he is advocating for an increase in minimum wage, which I see as a little bit of buckling. I know he doesn't stand for much, but getting him to stand on a principle is some momentum. So if we can call Senator Josh Hawley for one thing, make sure that we are protecting Medicaid for moms like Crystal who need that support, who deserve that support. She's out there taking care of her kids, advocating for what her child needs, and making sure that her household is still running. We do not need to work Americans any harder just to bail out big banks and big corporations who want better returns on their investment on the backs of us working class